was saying about wasting of money. So government officials who just waste, mismanage money really must have a syntax applied to them. So let me hand it over to you, Prof, for the final award, and that is the Distinguished Scientist Award. Please give a warm round of applause for that.
Okay, so Distinguished Scientist Award. I am now honored to present the Distinguished Scientist in Public Health Award. This award is a celebration of an individual whose contributions have left a lasting mark on public health and health research across the African continent. Today, we recognize someone whose unwavering commitment to public health has transcended borders and reshaped the global health landscape. This award is not just a token of appreciation. It's a testament to a life of service, passion, and dedication to the well-being of communities far and wide. In 2021, this award, then called the Life Achievement in Public Health Award, was presented to Professor Jean-Jacques Muyembe Tamfum for the role he played in advancing Ebola research. We also recognized Professor Salim Abdul Karim for his significant contributions to research in HIV prevention and treatment. In 2023, we honor Dr. Tedros Adhanom, the Director General of the World Health Organization, for his transformative leadership steering the organization through complex global health challenges with resilience and foresight. This year, a committee conducted a thorough review of candidates. So many truly outstanding candidates, and selected one whose contribution have been truly remarkable. On behalf of the CPHI Secretariat, I am honored and proud to extend our list of distinguished awardees to include another luminary, another exceptional leader, Professor Olive Chisana. Professor Olive Chisana has dedicated more than 30 years Professor Olive Chisana has dedicated more than 30 years to advancing public health both in exile and in South Africa. Her work in HIV/AIDS research, advocacy for national health insurance, and leadership in gender equality have shaped policy and improved lives. She has served as the first Director General of the Department of Health in South Africa, President of the International Social Science Council, and first female Chief Executive Officer of the South Africa Human Science Research Council. Internationally, she was Executive Director for Family and Community Health at the World Health Organization, chaired the BRICS Think Tanks Council and co-led the Access to COVID-19 Tools Accelerator to ensure equitable access to vaccines and treatment. As a social epidemiologist who conducts national research studies aimed at evidence-based health policy and program development, she is a world-renowned expert in HIV, having published more than 100 journal articles, book chapters, and monographs. Her academic and advisory roles include being an honorary professor at the University of Cape Town and a Doctor of Laws degree from Monash University. Most recently, she served as Social Policy Special Advisor to the President of South Africa, His Excellency Cyril Ramaphosa. In that role, she led the development of the 10-year strategic plan on gender-based violence and femicide and provided guidance on national health insurance and health systems reform. She now leads Evidence-Based Solution, a company focused on innovation in public and digital health across Africa. This year, she answered the call to serve as the co-chair of the 2025 edition of this conference. Over the last few weeks, she has been instrumental in shaping this week's agenda, ensuring the theme and threads of discussion spotlight the continent's health sovereignty agenda, especially with regard to primary health care, sustainable financing, and local vaccine production. Prof, I want to thank you for your hospitality and leading us to the success of this year CPHI convening here in Durban. More importantly, I want to thank you for your dedication to our people and our beautiful continent, ensuring policies are enriched in the principle of access, fairness, and world quality science. So, before I end my speech, Prof, I would like to tell you that when I was appointed as a co-chair, and I went to Google to know about that Olive, Prof. Olive Chisana. And when I saw just 3 pages, I think it's just the summary of the summary of the summary of what you are. So, and I was pleasantly surprised by your humility and simplicity. And then when I read this statement, I realized that it is the quality of extraordinary people. And so you are an extraordinary people. So congratulations, Professor.
Thank you so much, Professor Mbala. And Prof, you do indeed deserve a standing ovation. I know you're a force that does nothing in half measures, whose commitment is unfailing and unwavering. I say unfailing because what you do never fails, because you're so committed. And I heard the other day that evidence-based solution, if ever there was a person in human form, that is Professor Chisana. So a warm round of applause. Thank you very much. And also another warm round of applause to our other winners, the Investigator Award, Noluxabiso Mangwana, Diana Imali, Eric Angula, and Professor Olive Chisana. DG, thank you very much for your assistance. So that was encouraging to see two young women at the forefront of really impactful studies, and we hope that we are still going to see you, Dr. Angula. Let's move on with the program. Wrapping up now, we now get the contribution of those who've been remarkable and steadfast in supporting this program. Gavi, the Vaccine Alliance, as you know, has been really the cornerstone of Africa's march towards health sovereignty, transforming vaccine access from a privilege into a continental right. Allow me now to welcome Tabani Maposa, Chief Country Delivery Officer at Gavi, the Vaccine Alliance. Please give him a warm welcome.
Good afternoon, ladies and gentlemen, distinguished excellencies, DG, ministers here present, and colleagues. Gavi is very proud to be associated with this event, very proud to be associated with Africa. When I think of Africa, I call Africa home. But for Gavi, Africa is where most of our work happens. 80% of the work that Gavi does sits in Africa. And it is indeed, when I listen to Professor Shisana saying that 99% of vaccines are coming from outside Africa, why Gavi made a decision of setting up, in partnership with the Africa CDC, an instrument which is the Africa Vaccine Manufacturing Accelerator. This recognizes a call from Africa that Africa can no longer be in a situation where it relies on external support. I think Professor Shisana said it extremely well, that Africa must be in a position where it says it will not wait anymore for any help coming from outside. Help will be accepted, but we will not wait for that help to come. And Gavi, through its Gavi Leap, is saying it wants to hear Africa lead, it wants to understand where Africa is going and how it can play its role in supporting Africa in that regard. There are a number of things that I heard here today, but throughout the week, that have encouraged me immensely. On the first day, it was just the vibrancy and the energy that came through. You can see that Africa has a youthful energy that captures the moment. And in all the conversations that came through, we got to hear that Africa is ready to actually meet the moment. Africa's season and Africa's moment to lead is now. And in that moment, we as Gavi are committed to stand by you and besides you. I heard on issues of financing, the commitment to figure out how to finance, but I was also just impressed by the awards that we just saw now. As I was thinking about Eric Angula, I don't know where he is, but when he actually determines and he helps us to really smartly target where these resources are going to go, you realize that it is not just about more money, but it is about the health to the money that we are actually giving to Africa. So it is important that that money is used in the most helpful way. Let me also recognize the role of Africa CDC, a premier institute for Africa, an institute that has been important on global health security. When we talk about global health security and the pandemics and the epidemics that we have seen, particularly, let me talk about two. These are the mpox. The Africa CDC's leadership in partnership with WHO has been exemplary in confronting something that had been ignored for a period and a season in time. Secondly, cholera. I was in Zambia and I had the pleasure of seeing His Excellency DG, Dr. Jean Kasia, and the President of Zambia launching the cholera continental response. This was very important because as we see climate change and the relationship between climate change and cholera is one that we can indeed see as inexplicably high. And when we speak about AVMA as well, AVMA has prioritized the cholera vaccines as some of those vaccines that are going to be a priority because we realize that it is a disease of poverty, it is a disease that is ravaging the continent, and it is a disease that we must confront together. Africa CDC has offered significant leadership on the community health workers issue. The 3 million target has been something that we are rallying behind. Many of those community health workers are female, and we believe that we need to meet them fairly in terms of compensation and how they are integrated into the system. And we are grateful for the leadership that we have shown and seen in that regard. Last but not least, it is the issue of integrated service delivery. We absolutely recognize that delivering vaccines alone is necessary, but it cannot be sufficient. We need to think about strengthening primary health care and no longer deliver in silos, but deliver in an integrated way. As I leave the stage, ladies and gentlemen, I want to say, in the world where there is misinformation and disinformation, science cannot retreat. As misinformation continues to come left, right, and center, science must take a center stage. And it is forums like these that actually continue to hold the truth together. I thank you.
Thank you very much, Baba Posa. Thank you very much for your contribution and wise words. And now, let's get closing remarks from Dr. Boitumelo Semete, Chair of BioAfrica Convention. She has been instrumental in the vision and leadership of BioAfrica, or Africa Bio. She's driven innovation that turns science into sovereignty, and through its commitment to local research, we're talking ethical innovation and continental collaboration, Africa Bio is really shaping a future where Africa is not only a consumer of health technology, but creates them. So please give her a warm round of applause, Dr. Boitumelo Semete.
Good afternoon, everyone, and thank you again for staying on for an extra day with us here at the CPHIA 2025 conference. I'd like to say good afternoon to our Master of Ceremonies, distinguished delegates, esteemed partners, exhibitors, and our friends. As we draw to the close of the CPHIA 2025 conference in partnership with BioAfrica, it is with immense pride and gratitude that we reflect on the incredible few days that we have had, as we've all heard of the summaries from the last few days. Dr. Kaseya, I remember when in May this year at the World Health Assembly, together with you and Prof. Ngashi, and you came and you approached BioAfrica and you planted the seed of hosting this joint conference. At that time, it seemed impossible. But as Prof. Placide has said, impossible is not a word that is synonymous with Africa. When we set our mind to doing something, we get it done. And so thank you for trusting BioAfrica. Over the past week, we have witnessed a convergence of science, innovation, policy, and partnership. And this is exactly what we expected to see as we partnered as BioAfrica and CPHIA. As Africa, we do not have the luxury of working in silos. As we were commending our excellent scientists, ours as BioAfrica was to say, we would like to create an environment where you get to engage with the innovators, with those who commercialize the technologies that you're developing. Within our midst over the last few days, we had entities such as TokoBio, that is in the area of diagnostic solutions in the veterinary sector. We had the CSR that was represented in some of the sessions. We have BioVac that was represented. We had Aspen, but we also had ICGEB, just to name a few, which are entities that play a critical role in the commercialization of science. And for us as BioAfrica, we say such meetings are important. As I say, as Africa, we don't have the luxury of operating in silos. The excellent science that we see needs to be translated into solutions that not only have a national reach, but that have a continental reach. We have to ensure that in a room, while we have R&D and innovation, while we may have those that commercialize, we also need those that would finance, and I'd like to thank our partners that are financing the R&D and the technologies developed in Africa. We also need to have those that need to procure these solutions. There is no point in Africa developing these solutions without a confirmed market, as indicated earlier. But also, the solutions need to reach those that need them the most, which is the public. And so as we think about having these meetings going forward, let's ensure that we have a room, we have space to have an integrated stakeholder platform where we can all deliberate on how we each play our role in ensuring that indeed impossible is not synonymous with Africa. What we saw over the last 3 days was groundbreaking research tackling very critical health issues. We engaged in some exciting and very engaging panel discussions, and also we had some dynamic exhibitions showcasing Africa's ingenuity, and this conference has demonstrated the power of collaboration. As articulated by Prof. Olive Shisana, this is a message that we're certainly taking to our political principles in the G20 message, the Durban Promise. Together, we have not only exchanged knowledge, but we also built bridges between nations, between sectors, between ideas and action. For Africa Bio, we're quite thrilled to see such a diverse room. It's always been our intention that Africa Bio should be a Pan-African organization and a Pan-African convention. And I'd like to thank CPHIA for enabling us to achieve this mandate. We extend our heartfelt appreciation to our partners, the Africa CDC, and thank you for trusting us with this event. Indeed, it was not easy, but we've pulled it through. We would like to also acknowledge our own South African Department of Science and Innovation, who are pillars of the BioAfrica Convention. I'm also very thrilled that during these last few days, we had the Department of Health of South Africa represented in this meeting. I'd like to thank Gavi, the Mohammed bin Zayed Foundation for Humanity, the South African Medical Research Council, the GIZ, Aspen Pharmacare, the University of KwaZulu-Natal, the City of eThekwini, ICGEB, and all our sponsors and exhibitors who made this gathering possible. Your support continues to inspire progress and excellence in biotechnology and public health innovation across the continent. To our speakers and moderators, to all the participants, thank you for your contribution. Thank you for sharing your insights. Thank you for your unwavering commitment in advancing Africa's scientific leadership. Your voices and your ideas have made this conference a platform that provides one with hope, and hope that action will indeed be achieved. Many of us are walking out of here encouraged. We're walking out of here feeling very positive about the future of this continent. I cannot walk away from this platform in my capacity as the CEO of the South African Health Products Regulatory Authority and not talk about the importance of regulation, and also not talk around the vital role that Africa CDC has played in ensuring that we have the African Medicines Agency. The DG has been appointed, and she has promised to deliver on ensuring that regulation is not a barrier, but it is an enabler to access to safe, quality, and effective health products. Thank you all, and I hope you take some time off to enjoy this beautiful city of Durban. The weather is absolutely beautiful, and I hope you will have a fruitful stay.
Now we're really coming to the end of the program. The next speaker needs no introduction. He is the recipient. In fact, he is decorated as a Grand Officer of the Mauritanian Order. I don't know if you know that. And he is the first leader of an organization to do this. Declare Mpox, a public health emergency of continental concern. And he has worked at many of these international organizations with whom Africa CDC is in partnership with, confers with, and you would have seen through his leadership style and his passion that he brought at the opening, not only how committed he is, but how much he's still enthusiastic to continue leading with. Ladies and gentlemen, please allow me to bring to the stage for the closing ceremony His Excellency Dr. Jean Kaseya, Africa CDC Director General.
We need to applaud again for a person. I start to call her Tse. I don't know if you can allow me to call you Tse. I don't know how your friends are calling you, but you are just amazing. Let us applaud again for Tse. She's doing a great job. Excellencies, colleagues, dear friends, we are at the end of our CPHIA 2025. Let me share with you that myself, I was not believing that the CPHIA will take place. And as so many of you said, impossible is not African. We managed, all of us, to make it possible. Thank you to all of you. Let me thank our proud brothers and sisters from South Africa, from eThekwini region, from Durban city, for their hospitality and warm welcome. I want also to thank His Excellency President Cyril Ramaphosa, his ministers, Dr. Aaron Motsoaledi, Dr. Pala, and Dr. Blade Nzimbande, for their support and the support of their teams. I want to acknowledge the great support we got from Africa Bio, represented by my brother, Dr. Nsomi, and also from SAPRA. And you saw the CEO SAPRA delivering a wonderful message here on behalf of Africa Bio. They were great partners, and I hope we'll continue this partnership for other editions of CPHIA. The CPHIA was led and guided by two wonderful people, two proud African people, Professor Olive Chisana and Professor Mbala. They provided vision. Believe me, I didn't interfere. Even they decided to kick me out from their meetings to have opportunity to lead the CPHIA 2025. Many thanks to the government of United Arab Emirates, Mohammed bin Zayed Foundation, Gavi, World Bank, Team Europe, and so many other partners for their contribution, mostly voluntary contribution to the CPHIA. We had 4 awardees today, but I was informed that Eric, being the only man, decided to skip that because he was impressed by these 3 strong ladies. I'm proud that I was with you, the only man taking photo with you. Congratulations to our 4 awardees. I think we'll take again another photo with them. To all of you, ministers, VIPs, partners, speakers, panelists, exhibitors, scientists, friends who decided to attend the CPHIA despite all challenges that we faced, despite the short notice. We are so grateful. The CPHIA is a success because of all of you. Thank you so much. If there were so many sessions, I can say I attended one from the beginning to the end. It was a session dedicated to young people because I want to thank our young people. They are so innovative, creative, and they committed through the strategy for youth engagement and participation that they launched yesterday to make their voice loud and to challenge all of us. I didn't know that I was elder. Yesterday I was informed that they are calling me elder. Then let me thank my own colleagues from the CPHIA Secretariat and Africa CDC. You did a great job. Excellencies, colleagues, if I have to be honest, if there is a failure in the CPHIA, it's only one failure. They wanted me to speak after Professor Olive Chisana because she said everything I wanted to say. Even she said more than I wanted to say. Then what do you want me to say again? Then my role is just to thank Professor Olive, your speech, ending by saying power to Africa, is resonating. This is something that all of us will need to take time to digest. And we'll put that in the Africa CDC website, like other speeches that we had. But this one is really showing the direction where Africa is moving. And you gave us opportunity to get the sense and the flavor of the communique and the recommendations that CPHIA is bringing to the G20 ministerial meeting and the G20 presidential meeting. We are so proud to say that our G20 colleagues are waiting for these recommendations. They will integrate that and to be part of the decisions that our head of state from G20 will make. Thank you for the wonderful job. And then we decided together to reaffirm our collective ambition to accelerate Africa's journey toward health sovereignty. Health sovereignty came in almost all of our discussions and deliberations. It has been inspiring to hear directly from all of you, and especially from young people, about the exceptional work being done to support public health in Africa and to ensure resilient, strong health systems across Africa. This year's theme, moving towards self-reliance to achieve universal coverage and health security in Africa, was a powerful and a strong message to all of us and for all of us. I'm partly impressed by the strong consensus reached here in Durban on the urgent need to accelerate our effort to achieve this agenda of health sovereignty. Colleagues, because we need to end with some good news, I want to share with you some good news. This good news will help us to translate some of our strategic thinking into action. The first one, we want to see the digital agenda being a reality in Africa. Look, in 2024, only 38%, 38% of African population had connectivity. With that, how can we dream to have a strong digital agenda? To address this issue, Africa CDC started from several months to negotiate a specific package of internet connectivity for all Africans. Therefore, ladies and gentlemen, aiming to provide connectivity to all community health workers, all health centers, all hospitals, professional and national systems, I'm glad to inform you that the first week of November in Washington, on behalf of Africa CDC, I'll be signing the mega and transformative MOU with Starlink to provide connectivity to all African people. This partnership with Starlink will use the health sector as the entry point for the development of other development sectors in Africa. The second one, 2 days ago, my twin brother, Professor Janabi, was informing us that to reach Bulape, that is the epicenter of Ebola outbreak in DRC, people are taking 4 days. For those who don't know Bulape, it's just 1,147 kilometers from DRC, from Kinshasa. If we had good quality road, that could take 11 to 12 hours to drive from Kinshasa to Bulape. But this is the reality, not only of DRC, but of so many African countries where remote areas are not well connected and they are not benefiting from services wanted them to get. In addition to the Starlink MOU, we managed to finalize the MOU that we are signing with the witnessing of so many other partners. This MOU will be signed with Zipline the first week of November in Washington. As you know, we are working also with African innovators, and we are saying we'll use these MOUs to build the capacities of many Africans and to make sure that in the nearest future, African innovators will replace our global partners. For now, we are moving by making sure that our people, they will get all services. The third one, long time ago, since we started in Africa CDC, we are saying we want partners to respect our countries, to respect our government. And we requested our partners to give us opportunity to lead our programs and them to come to support us. In March 2025, for those who don't know that, we went in Washington to meet the US government to tell them what we need as Africans, what could be the next program that will replace USAID. This is a true story. March 2025. I had a meeting at State Department with 16 US agencies, all of them coming from White House, State Department, Defense, NSC, and so many other places. Our message was consistent. We want you to tell us how much you'll give by following the program and the material plan of our government, but by also requesting our government to contribute. In September, when the US was launching the America First Global Health Strategy, they recognized the role that Africa CDC played, and they requested Africa CDC to support the implementation of this program. This program, we are thanking the US government. Not everything is perfect, but it's the starting point. It's the starting point for what we are calling the Lusaka agenda, better alignment of partners under the leadership of our government. And Africa CDC will be part of the team that will visit countries mid-November to provide appropriate support to our government when they will be discussing with the US government. We are starting now. This is why, ladies and gentlemen, I decided to appoint a proud African, a guy coming from Malawi, Gerald Mantalo, who is known and respected over the world as the Lusaka Agenda Guru. Gerald, from today, is the senior advisor and the lead of public finance management and Lusaka Agenda in Africa CDC. He will be leading this agenda with 20 other PFM specialists that we are recruiting and we are sending to countries. We don't want again to see the Minister of Health saying, I don't know how to talk to the Minister of Finance. Each country will benefit from strong and experienced public health management specialists to bridge Minister of Finance, Minister of Health, Minister of Planning, and Minister of Budget. Because we are serious with this agenda of health sovereignty and sustainable health financing, we need to move from meetings, from discussions into concrete delivery and action. I will stop by saying it was great to be in Durban, but in Africa CDC we dream big. Ladies and gentlemen, we are meeting again next year. Now, it won't be short notice. Now we are informing you. The next CPHIA will be a big one. I just finalized today a great discussion with political authorities of Ethiopia, who requested to host CPHIA 2026 in November 2026 in Addis Ababa. Other good news, Ethiopian Airlines decided to partner with us, and they will give us some discount for those who will start to register. You'll pay around 10 to 15% less than normal tickets. And we also have finalized a partnership with one of the biggest companies in the world in terms of event. This company is organizing, for those who know that, the Dubai Exposition. This company is Informa. Together with Informa, we are changing the business model of CPHIA to allow the CPHIA 2026 to receive at least 30,000 people physically in Addis. Welcome to Addis.
Thank you so much, Dr. Kasea. Please give him a warm round of applause. And I hope you're packing your bags already for the next conference. Well, this is where my role ends, and I want to say thank you so much for indulging me. In my language, Kasepedi, ga di fele, meaning there's still lots to discuss, lots to do. Ke le lakaletsa tsela tshweu. Safe trip wherever you're going. If you're staying, please enjoy a bit of Durban. You know, in the past, you would get a 2-liter bottle. Those of you who are old enough know this. You go to the ocean, pour some in the 2-liter bottle as a reminder that you are in Durban, eGagasini, by the beach. So we're a protected site, so please don't do that. But certainly do go out, enjoy the seafood, enjoy the people of Durban, and hopefully we'll see you the next time. From myself, goodbye and safe trip.